Congratulations on your new braces! It is important to have great oral hygiene, which will keep your teeth and gums healthy and help speed up your treatment. Here are some of the tools you'll find in your braces care kit. Be sure to choose a manual toothbrush with soft or ultra-soft bristles. Hold it at a 45-degree angle to your teeth, so it fits right between your braces and your gums. And move it in a circular motion from one end of your mouth to the other. Then, you want to change the angle so the brush head is now between your braces and the bottom part of your teeth. Again, moving it in a circular motion. Please avoid brushing only horizontally across your teeth, as this will surely allow you to miss much of the things you should brush away along the gum line. Don't forget to brush the biting surface and the tongue side of your teeth as well. If done correctly, you should be brushing your teeth for at least 2 to 3 minutes each time. You can check with the timer we've included in your kit. If you finish brushing before the timer runs out, please go back to the area between your braces and your gums again. We highly recommend electric toothbrushes with rotating and pulsing motions like the one pictured. If you have one with sonic vibrations only, please make sure you're doing the same circular movements as with a manual toothbrush. With a rotating brush head, you just need to make sure to position it correctly. Start from the area between the braces and the gums, and then move it down to cover the area between braces and the bottom part of your teeth. Move slowly enough to allow the brush head to do its job. Take your time going from tooth to tooth, and be sure to cover all the surfaces. You will still brush for at least 2 to 3 minutes if done correctly. Next up is flossing. Included in your kit are some floss threaders to use with regular floss. The floss threader is flexible, but also a little stiff to help guide your floss better. Thread your floss through the opening and pull a short segment through. Pass it underneath the wire, then floss to the contact. Use good technique. Curve it to both sides and let it go a little bit below the gums. Don't forget to pull the floss out towards the front to remove it. Super Floss has a stiff end built in already, so no threading is needed. If you prefer to use floss picks, Platypus Flosser is made especially for braces. It has a skinny flat side and a thicker side. The skinny part can fit between the wire and your teeth, and just like when using a normal floss, you should try to hug the sides of the teeth. Just like that, you can then floss between all your teeth. Another useful tool is a proxy brush, which features a bendable tip with short, soft bristles. You can use it to clean the tooth surface between two braces if needed. But if it's hard to push the brush into an area, please don't try to force it, because you might accidentally break a bracket or injure your gums. Use it only in those areas where you can be sure to use it gently. Brush well at least twice a day and floss once a day so you can have beautiful and healthy teeth at the end of braces. Let's talk about wax. You may be noticing that some of your braces are rubbing on the inside of your cheeks and lips. Before they're used to it, you should use orthodontic wax to cover the brackets. Pinch off a small piece of wax, soften it by rolling it between your fingers. Then squish it over the spot that is bothering you. Make sure to mold it around the bracket so it locks into the corners. If the wax has trouble staying on, dry the area before applying it. Use it on all the braces that may be bothering you. You can leave the wax on during eating, but should remove it during brushing. If you happen to swallow some, do not worry, it is not harmful to you. If you didn't use wax in time and a sore has developed on the inside of your mouth, you can rinse with warm salt water and use Orajel if it's really painful. You can get Orajel over the counter and it will numb the sore spot temporarily. You should still use wax to coat the braces while your mouth is healing, which may take up to 2 weeks to fully heal. Once the wire has started to work their magic in a few hours, you may notice a dull, achy sensation for your teeth. When that happens, you can take Tylenol or Advil or whatever you normally take for a headache or muscle ache, and it will help greatly with the pain. This pain may peak on day 3, but it will get significantly better after. It's also helpful to eat some foods that doesn't require a lot of chewing the first couple of days. Next, we'll talk about pokey wires. We always make sure your wires aren't poking when you leave the office, but sometimes when your teeth move or the wire shifts by accident, it may poke out the back. You should always give us a call first, and while you're waiting, you can put some wax over the area, coating the piece of wire that is long. If you're unable to come in and the wax doesn't seem to do the trick, an adult can also help you cut the wire using a disinfected heavy nail clipper or wire cutter. Make sure not to cut the wire near the end, but rather between 2 brackets that still have the color bands holding the wire in. This way, the back piece won't move too much since it will be held in by the color bands. And then, you can remove the back piece of wire by using a pair of tweezers to pull it forward. If a wire popped halfway or completely out of the last bracket, and you're able to have good visual using the mirror we gave you, you can use a pair of tweezers to insert it back into the bracket. If you're unable to reinsert it, you can try to tuck in the wire above the bracket. It will keep it away from your cheek and buy you some time until you can see us. If it's one of the metal ligature ties that is poking you, simply push it towards your teeth, away from your lips and cheeks, using a pencil eraser or a Q-tip. You can also place some wax to cover it. A bracket may come loose if you ate something hard or crunchy, and sometimes you may only notice it when you brush when it slides along the wire. You should call us to let us know so we can prepare accordingly for your next appointment. Most times, these won't bother you or give you any pain. Avoid playing with the loose bracket. If the bracket spun around on the wire and is scratching your cheek, use a pair of tweezers to spin it back, or put a piece of wax over it. If you notice your metal band is loose or moving on your back teeth, call our office so we can set up an appointment. Brush well around the area and stop wearing any rubber bands that hooks onto these metal bands. If the metal band is not very loose, you can push it back onto the tooth in the meantime. If the band is very loose, then you can remove it from the tooth using your fingers. You may need to clip the extra wire as we've shown you earlier. Last but not least, there are some changes you need to make to the foods you're eating. We understand it is sad, but eating the wrong kinds of foods can damage your braces and make your treatment longer. You must avoid hard and crunchy foods like the ones shown here. You should also avoid sticky candies like the ones shown here. Please cut up your fruits and veggies into thin slices or small bite-sized pieces and avoid biting into them whole, as this may break your braces. Meat should be taken off of the bone before being eaten, and the same goes for chicken wings and corn on the cob. A detailed list will be given to you, so please take the time to review that. Congratulations again, and we know you'll do a great job. Please feel free to give us a shout anytime if you have any questions or concerns. We're so honored you've chosen us here at Heart Orthodontics, and we look forward to seeing you at your next visit. Take care!